now I'll go back to what I mentioned. A number of people have wounds, which may be a sickle cell wound, maybe a post-traumatic wound, maybe even a post-infective wound, usually on the lower limbs with associated swellings of the leg. Apart from the wound care treatment that is given to that leg, in order to enhance a speedy healing of the wounds, you also want to reduce the edema of the wound, because usually the patients will want to walk around even though they have wounds. The alternative will be for them to be on bed rest and with their limbs elevated. But you may not want to do that for quite a long time because it takes some time for these wounds to heal. So in order to be able to still maintain a leg that is not swollen, and as you are taking care of the wounds, what will result to is to give what is called a compression bandage, which usually starts from just beyond the toes and it goes all the way, wrapped all the way up onto around the knee. And in the process of moving around, the leg does not swell, even though the person is moving around. It tends to be a bit uncomfortable and tight, but as it gets used to it, you find out that many wounds tend to heal at a much faster rate when a compression therapy is used as opposed to one that is not used when there's a swelling of the leg. Apart from wounds, or what you call post-traumatic wounds, and other kinds of wounds that had swellings, even when it comes to the aspects of swellings of the legs without wounds, compression therapy can also be used for what you call venous wounds, a pregnant woman that has a swollen leg, or what they sometimes call a lymphedema, in which there's swelling of the leg. You can actually wear a compression stockings, which will prevent swelling of the leg, in which you are trying to manage that particular process.